A yeast infection is a fungal infection that can affect the vagina or the vulva labial area. It can also include the groin area in some women, and sometimes in the lower abdominal region when women have skin that will overhang, sometimes they'll get yeast infections in that area as well. It is very common, and it's so common, in fact, that there are plenty of over-the-counter regimens that are available for treating vaginal yeast infections. Symptoms are mostly itching and burning. So those are the most common, but then it can also be accompanied by different types of discharge. So some women will have an increased amount of clear discharge. Some women will have a white chunky discharge. Very unpleasant symptoms are associated with yeast infections. So over-the-counter treatments are the antifungals that are available, like miconazole. That's one of the most common ones. The time when people would want to come see us is if they've tried an over-the-counter regimen and their symptoms have not improved or they've worsened. Most people can't tolerate a yeast infection for very long. It creates so much inflammation and pain that people come in for treatment very quickly. There can be hormonal shifts and changes that can affect people's likelihood of developing yeast infections. So for instance, pregnancy can result in a change in their hormones that results in an increased likelihood of developing a yeast infection. Sometimes when women go through menopause or they have hormonal changes related to that time of life. Sometimes there are, exposure to certain chemicals and other things like swimming in a chlorinated pool or other situations in which people will notice that they'll be more likely to develop those particular symptoms. Diabetes is also an increased risk for people with yeast infections. So when their sugars are not as tightly controlled, that is food for the yeast, and then you can get an overgrowth of yeast. Yeast is a normal part of vaginal flora, but it's one of those things that you don't want an overabundance. There's a balance of the bacteria and yeast that are present, and sometimes things allow an overgrowth of the yeast, or sometimes the bacteria too. So you can have an overgrowth of bacteria that causes a problem as well, and that's called bacterial vaginosis, and that's treated very differently. Most women, their bodies stay within a healthy balance of the normal flora within their genital area, and in some situations that balance can come out of whack by no fault of their own. And it just happens sometimes, and we're glad to be there to help when women need advice or treatment for any symptoms they're having.